Welcome. It's Time Warner Cable's local edition. I'm Brad Pomerance. I'm glad you're with us today. We are joined by Aileen Harper. She is the executive director of the Center for Healthcare Rights, which is what?
We're a nonprofit healthcare advocacy organization here in LA County, and we specialize in providing Medicare advocacy and health insurance counseling services for all Medicare beneficiaries in our county, their families, caregivers, friends.
And let's focus on the difference between Medicare and Medi-Cal, Medicaid, because there's a lot of confusion.
Sure.
We hear about the Affordable Care Act and the Medicaid expansion. Nothing to do with your work, mostly.
No. Mostly,
Mostly.
Yes. Well, Medicare is a federal health insurance
Right.
program. It exists all over the country. So if someone has Medicare, their Medicare is the same whether it's in California or in Minnesota.
And generally, this is generally, Medicare is for seniors.
Medicare is for people who have paid into the Social Security system.
Right.
So people who have Medicare generally are getting either Social Security retirement
Right.
or Social Security disability. So there are two populations
tell
of,
us,
of
please.
Medicare beneficiaries. There are people who are age 65 and older who have Medicare because they're getting retirement benefits. But there also are people who are younger
Right.
who have Medicare due to disability who are
Right.
getting Social Security disability.
There is one place where your organization and the ACA connects, and that's with those that are receiving dual benefits, Medicare and Medi-Cal, Medicaid.
That's true. In LA County, we have 1/3 of the Medicare population have both Medicare and Medi-Cal. Nationally, it's called Medicaid. And California has, about 2 years ago, initiated their interest in participation in what's called a duals demonstration project. There's several all over the country. So the ACA provided the federal funding for the demonstration project. So what California is doing is they're trying to create an integrated care model for people who have both Medicare and Medi-Cal. So to make it very simple,
If you can.
yeah, very simple. This past year in LA County, the state has begun to move people into what's called the CalMedi Connect
Right.
program. Now, you don't have to participate if you don't want to. You can say, I'm not interested in participating in the demonstration. However, if someone with Medicare, Medi-Cal chooses not to participate, they are being required to enroll into a Medi-Cal plan in order to keep their Medicare benefits the same.
And that's why you're around. You're helping folks navigate this.
Yes, it's a very, very complicated program. A lot of people are very, very, very confused. There's over 200,000 people in our county alone
Right.
eligible for the demonstration, so we have been getting many, many calls over
But
the
is the
last several months.
demonstration, you know, there are bumps with every new program, but presumably it will be of benefit to your clients?
Potentially it's a benefit, but I think the main problem that we're having in LA County is that many physician groups have chosen not to participate in the CalMedi Connect plans available.
And let's talk about physicians, because after many years, there actually is a fix as it relates to the participation of docs in Medicare programs, at least an incentive for them to come back.
Right, right. That's a very good point. In April, Congress passed legislation which the president is assumed to sign, which basically is going to attempt to reform how physicians are paid under the Medicare program. And so under this new payment model, so to speak, for the first 5 years, physicians will get a 0.5% increase in payment across the board, all physicians. And during that 5 years, the Department of Health and Human Services has been given the mandate to essentially create new payment models that will essentially pay physicians based upon quality and efficiency.
And not service.
That's right, not service.
Okay, her name is Aileen Harper. She is the executive director of the Center for Healthcare Rights. Thank you for what you're doing for Los Angelinos. My name is Brad Pomerance. It's Time Warner Cable's local edition.